Well, I think that when people get older, there's a great propensity to develop prostate cancer. So many people will get it as they reach the age of 40, 50, 60, 70. It just becomes much more prevalent as you get older. So the probability of developing prostate cancer in most men's lives is very great. I think it's critically important for men to be screened for prostate cancer starting at the age of 40. So often with my patients, I find that a lot of them think that simply because they're not 50 or 60 years old that they don't necessarily need to worry about having a prostate screening. The prostate screening should include a digital rectal examination as well as a PSA, prostate-specific antigen test. So I have detected many prostate cancers in men in their 40s and in their 50s. So it's much more prevalent at an earlier age than men actually realize. Prostate cancer, of course, is a medical conundrum. It's a puzzle. We don't have all the answers for it. In some men, it may be very slow growing, and in some men, it may be very, very aggressive. And for that very reason, that's why it's important to have this screening done with the PSA every single year, simply because the change in actually what that PSA is doing from one year to the next could actually tip somebody off that they are actually having the prostate cancer. So I have found in some men they may have a normal PSA within the guidelines of what the laboratory suggests based upon the blood test. But on the other side of the coin, it may be much higher than it was perhaps a year ago. So if they have a significant change in that PSA, then they ought to see a urologist, they should have a biopsy done, and be followed on a regular basis. Prostate cancer seems to be on the rise, and I don't think it's simply due to the detection of it based upon the blood tests that we've been doing. I think it's a factor of whatever is happening in the environment, whatever is happening in terms of men and their eating habits, their exercise habits. I think all of those things play into the fact that prostate cancer is definitively on the rise in this country. Well, I think the misconception about prostate cancer is the fact that most men don't realize that it can occur at a much earlier age than they realize. Again, the symptoms of prostate cancer will vary in everyone, and some men may not have any symptoms. So that's why the PSA test becomes critically important. We often think that, okay, if a man has nocturia, getting up in the middle of the night and going to the bathroom, that's a tip-off that he may have prostate cancer. It may simply be benign prostatic hypertrophy. It may simply be an increase in the size of the prostate and not be related to prostate cancer at all. But who's to say if it is actually prostate cancer? So the only way to definitively diagnose it is, again, to have a PSA screening test, a digital rectal examination, and to see a urologist if that's necessary. I think that the prostate on-site project is extremely important to detecting prostate cancer early. I think it's a great benefit to the community. I think the fact that you have the mobile units that go around that make it easily accessible to individuals who may not be able to get to their doctor, that they can have this test done, I think it's a tremendous thing for the community and for the state of Arizona. Prostate cancer can be prevented from the standpoint of preventing the serious consequences of it. People die of prostate cancer every year. By having these screenings, you can detect it early. If it's detected early before it's metastatic, before it's spreading throughout the body, that's critically important to preventing a person from dying from prostate cancer. So it's very frustrating as a physician when patients will come into my office and they say, well, I don't want to spend the money to have the PSA done. I don't really want that digital rectal examination because it's uncomfortable. I mean, that's absolutely ridiculous in this day and age. You need to detect this disease early in order to prevent the serious consequences and the deaths that can ensue from this serious disease. So the prostate on-site project is critically important to lowering the incidence of prostate cancer in this state from the standpoint of the serious consequences that are involved. Men are generally in denial about their health. They don't want to get checked up. They don't want to come in and have a stress electrocardiogram. They don't want to have a prostate exam. I had an individual who came in to see me about 3 months ago. He had not been to a doctor for 15 years. We diagnosed him with coronary artery disease, we diagnosed him with diabetes, and we diagnosed him with prostate cancer, for which he had a prostatectomy. So fortunately, we're able to detect that early, again with the PSA test, and he's doing very, very well now, and it had not metastasized throughout his body. So again, there's one example of someone getting the test early, an individual who's in his 50s, not seriously old or 70 or 80, and we often hear of those cases as well, and people will again be in denial, figuring that you know, they're 75 and why should they even bother having this test. I think that people should have the PSA test regardless of what age they are. I think the things that have occurred over the past decade in terms of prostate health have been tremendous. Number one, the awareness of the public about prostate cancer. I think that's helped tremendously. The wives are generally the ones that send the patients in to see me. You know, they're the ones that probably detect the prostate cancer early. And men are, of course, fearful about it because they feel as if, you know, if they have any issues with their prostate, that's going to cause erectile dysfunction, and that's going to be a serious consequence. But again, with all of the newer techniques, the robotic surgeries, and the things that are being done today, you can detect this disease early, you can be treated for it and not have any of the consequences. You can have the nerve-sparing type of surgical procedures, which are critically important.